Hi there, my name is Richard McMunn from the interview training company passmyinterview.com, and in this tutorial I'm going to teach you how to pass an NHS Band 3 interview. Now, it does not matter which Band 3 role you are being interviewed for, all of the questions and answers within this tutorial will be applicable to your interview. So it does not matter if you're applying to be a healthcare assistant, a support worker, a nurse, a radiographer, a clerical or admin worker. It does not matter which Band 3 position you are applying for. Please do make sure you watch this fully from beginning to end, because it will help you to be the standout candidate. Now, to achieve that goal, this is what I'm going to cover throughout this tutorial. I'm going to give you a list of NHS Band 3 interview questions that I recommend you prepare for. I have carried out extensive research, and I believe all of these questions are likely to come up during your NHS Band 3 interview. I will also give you suggested answers to those questions to help you succeed at your interview. I will tell you the skills and qualities that you must demonstrate throughout your NHS interview, and I will also explain where you can get access to further training resources to help you succeed at your Band 3 NHS interview. So 4 great reasons why you should stick around and watch this fully from beginning to end. Now, before I get into the tutorial, a very warm welcome to this NHS Band 3 training interview presentation. My name is Richard McMunn. That's me there in the centre of the screen. I am a former fire officer of 17 years, and since then I've been helping people to pass their interviews, and I do that by always giving you top scoring unique answers you can't find anywhere else. On that basis, please make sure you subscribe to the channel by clicking the red button below the video, and then you're not going to miss out on any of the weekly training videos I upload. You can also connect with me on LinkedIn if you want to. I have put my LinkedIn link in the description below the video, and it's always great to connect with like-minded professionals such as yourself. Please also make sure you give the video a like, because that tells me you enjoy the content, and I will therefore spend more time creating it for you. Okay, let's get into those NHS Band 3 interview tips, the interview questions, and also the suggested top scoring answers. Here we go. So the first question that I want you to prepare for is, tell me about yourself and why you want to work for the NHS in this Band 3 role. Now, this will be the first interview question of your Band 3 interview, and it's absolutely vital you talk about the values of the NHS in your answer. Here's a great suggested answer to help you prepare. I am extremely hardworking, conscientious, caring, and totally focused on completing my work to consistently high standards. The skills, the qualities, and the experience I possess are a solid match for this Band 3 role, and I am confident you'll be pleased with my strong work values and ethics. I want to work for the NHS because, having studied both the job description and the values expected of all staff, I feel this is somewhere I will get to put my skills to good use whilst working alongside some incredible people who are all working towards a common goal. Let's now take a look at the next NHS Band 3 interview question that I want you to prepare for. How do your skills and qualities meet the job description of this NHS Band 3 position? Now, to answer this question correctly, we need to ensure we study the job description for our particular role, and without doing so, we will not be able to provide a good enough answer. However, I've done the hard work for you, and here is my suggested response. Now, I'm going to provide you with 2 sample answers. One is for Band 3 clerical and administrative roles, and the second answer is for Band 3 patient focused roles such as healthcare assistants, support workers, nurses, etc. So the first one will be for admin and clerical NHS Band 3 roles. Here it is. I have studied the job description and I'm confident my skills, qualities and experience are a strong match for this Band 3 role. For example, I am an excellent team worker, and I can also work on my own whilst following strict guidelines and operational procedures. I have excellent attention to detail skills, and I can also work under pressure whilst managing and completing lots of different tasks. The experience I have means I can work alongside different people from different departments, and I will be able to provide effective and efficient clerical and administrative support to teams of healthcare professionals to help them achieve their objectives without additional stresses and pressures. So that's a great answer for admin relative roles. Here is the second answer for patient-centred NHS Band 3 roles. So how do your skills and qualities meet the job description of this NHS Band 3 position? Here is my answer. Prior to applying for this NHS Band 3 role, I studied the job description to make sure I have the necessary skills, the qualities and the experience to excel within the position. For example, I have the ability to both participate and assist in the delivery of excellent patient-centred care to users of the NHS. I can also be relied upon to follow strict rules and procedures, including those relating to safeguarding and confidentiality. Now, due to the many years' experience I have gained, I fully understand how important it is to always strive for excellence because that's what patients deserve. Finally, I have excellent communication, team working, and attention to detail skills, all of which will enable me to perform consistently to high standards within this position. So that's another really good answer to that tough NHS interview question. So the next one I want you to prepare for is describe a time when you demonstrated one of the NHS core values in your work. This is a difficult question, but it is very common during Band 3 interviews. Now, to answer this Band 3 question correctly, obviously we need to first of all know what the NHS values are. So let's take a quick look at them before I provide you with a suggested answer. So the 6 core values for the NHS are respect and dignity, commitment to quality of care, compassion, improving lives, working together for patients, and everyone counts. So we need to think of a situation we've been in previously where we've demonstrated one of those values. Now, when you are responding to this behavioural type interview question, my advice is to use the S.T.A.R technique because they are asking you to give them a specific situation you have been in. And by using the S.T.A.R technique, it will ensure that you give a brilliant specific answer. Now, the S.T.A.R technique means that you will structure your answer using situation, task, action, and then result. The S.T.A.R technique. So you start off your answer and you tell the interviewer the situation you were faced with. You then tell them the task that needed to be done. You then move on and explain in detail the action that you took, and you finish off with the results following your actions. So it's situation, task, action, result. Let's now take a look at a suggested answer that uses the S.T.A.R technique for the NHS Band 3 interview question. Describe a time when you demonstrated one of the NHS core values in your work. Here we go. I was working in a previous patient-centred role alongside other healthcare professionals. One particular patient had very specific needs that required all of us within the organisation to maintain regular communication in order to provide quality of care. It was my job to ensure after every visit or appointment with the patient, I conducted a patient needs assessment before passing on the information to the other healthcare professionals. During each visit or appointment, I would provide excellent levels of care, whilst at the same time completing all risk and needs assessment documentation. I ensured quality of care by taking the time to ask the patient relevant questions and by also checking back on the previous assessment documentation. Now, following each visit, I then shared the information I had gathered with all of the other healthcare workers and interested parties. Although this was an extremely lengthy and time-consuming process to follow, I was 100% confident the patient was safe, their needs were met, and everyone within the team had the necessary information to continue their own commitment to quality of care. Now you can see how by using the S.T.A.R technique, it makes your answer in-depth, solid, and positive. So that's a brilliant example of that time when you've used or demonstrated one of the NHS core values in your work. Now, please don't go anywhere because I still have more questions to run through, but when you are ready, if you click the link in the top right hand corner of the video, it takes you through to my website passmyinterview.com, where you can download my full set of NHS Band 3 interview questions and answers in PDF format, and it is applicable for all NHS Band 3 roles. However, let's now take a look at another interview question to help you prepare. Tell me what you know about confidentiality in the NHS and how you'd maintain it within this Band 3 role. Quite a difficult question. Now, the NHS, as you probably know, has a code of practice in relation to confidentiality. My advice is to refer to the code of practice within your answer before then outlining what you would do on a daily basis to maintain confidentiality. Here's my suggested answer. The NHS has a definitive code of practice that determines the standards required for all NHS organisations and personnel in regard to patient confidentiality. NHS staff and healthcare professionals must carry out their duties in strict confidence, especially in respect of a patient's medical information, their records, and their personal data. However, information amongst care teams can be shared when there is a requirement for the safe and effective care of an individual. At all times, a patient's right to object to the sharing of confidential information has to be respected. On a day-to-day basis, I would ensure I always followed the code of practice. I would make sure I never left confidential information or records lying around, and I would never discuss anything about a patient unless it was within the permitted realms of my work, with authorised personnel, and also within the boundaries of the code of conduct. So that shows you understand what the code of conduct is and what you would do on a day-to-day basis to make sure it's maintained. So the next NHS Band 3 interview question is, what are the different challenges facing the NHS? Now, this is a clever interview question because it assesses what you know about the NHS and also whether or not you have the capacity to cope with the stresses, the pressure, and also the workload. So here's my suggested answer for your Band 3 role. Here we go. The NHS is facing many challenges, including an ageing and growing population and the fact that Brexit may make it harder for overseas nurses and medical staff to gain employment within the NHS, which means there could be a skills shortage. There are also other challenges, including ever-changing and evolving healthcare needs, resistance to antibiotics, new illnesses and diseases, restrictions on budgets, and also the fact that new medical advancements, whilst highly effective, can be very expensive. There is also the challenge that some local services are closing, and there is an increasing reliance on private sector medical services and facilities. Now, this is why it is so important to always work towards achieving the 6 NHS core values in your work. I believe strongly that if everyone in the NHS focuses on providing quality of care at all times and they maintain the highest standards achievable, the NHS will continue to succeed and be highly regarded throughout the world. That's a great answer. Those are currently the challenges, some of them that the NHS is facing, and then you're explaining how by following those values, the 6 core values, you will be able to overcome them and meet the demands of the role. So the next thing to do is to click that link in the top right hand corner of the video. Go through to that page because it will give you a full list of the NHS Band 3 interview questions that I recommend you prepare for. There's some important tips on that page as well that I recommend you read and study that will help you to pass your interview. And you also have the option, whilst you are there, to download all of the answers to those questions. And as I mentioned previously, these answers are perfect for all NHS Band 3 job positions. Thank you very much for watching. I wish you all the best for passing your NHS interview. Please don't forget to subscribe and hit the like button because that tells me you enjoy the content and I know it's worth me spending the time creating it for you. Have a brilliant day and I wish you all the best. Thank you very much.